All right. So there was a question about the start triage in terms of what do you do for the airway? Yes, you are correct that the person, especially the triage officer, remember that person's job is not to get bogged down in treatment. You're just kind of sorting through the people quickly to figure out, kind of sort them out so that the next responders can kind of go in and treat the patient. So yes, what the triage officer would do is you're going to open the airway. But what I was talking about in terms of what is the fix for the patient, it's ventilation, but it's not for the triage officer to start the actual treatment. Does that make sense? Give me whoever asked that. Give me let me know if that makes sense. I think that was Amanda.
Yeah, it was Amanda. Yep, it does now.
Okay. All right, cool. And who was there? Jonathan, you ready to go back with us?
Yes, sir.
All right, let's go. So let's do another one. If you guys need to go, that's fine. We'll probably go about 30 more minutes, but if you need to go sooner, no problem. All right, let's go to the next one.
What is the most immediate priority?
Okay. So this is a two-step question. I need a story because I don't know what's the situation. So let's go.
A 45-year-old male overdosed on opioids.
Okay.
He is cyanotic with snoring respirations at 6 breaths a minute and an SpO2 of 72%.
Okay.
He has a strong carotid pulse. Your partner is preparing naloxone.
Okay. Now, so what is the immediate? So first of all, what kind of problem is this? Is this oxygenation, ventilation, or perfusion primarily?
Ventilation.
This is primarily a ventilation problem because of the respirations at 6 times a minute. Okay.
Yep.
So he's hypoventilating, and when he hypoventilates, when he doesn't breathe off enough, what does he hang on to?
CO2.
He hangs on to too much CO2. And remember from last week, we said that CO2 combines with water. That's going to ultimately form carbonic acid. And that's how the CO2 leads to acidosis. And what does acidosis do to the blood vessels?
They vasodilate.
It causes vasodilation, especially in the brain. It causes cerebral vasodilation. And that can also lead to shock in the whole body, but in the brain, it can lead to increased intracranial pressure. Okay. So what's my immediate fix for this being a ventilation problem?
It would be a BVM.
All right, we're going to go BVM. Do we use BVM by itself?
No, sir. You'd use it with an airway adjunct and oxygen, high flow O2.
There you go. So we're going to use a BVM to assist ventilations, but anytime we're using a BVM on anybody, we should probably consider an adjunct, and we automatically need to power it up with oxygen. Okay, so find our answer.
It would be C.
Just like that, C. Okay. Now, they could have changed this question, and see, this question was about opiate overdose. They could have made it a benzo overdose. They could have made it alcohol intoxication. They could have made it a neuromuscular disorder. I could have changed a lot of details, but it still came down to this is a ventilation problem. Okay. And the fix for that was we need to ventilate with a BVM and high flow O2 plus an airway adjunct. Let's do another one.